Victorians will learn the finer points of how the government plans to ease the state out of lockdown restrictions this coming Sunday. But the Premier's promise to share the plan came on another day of high case numbers and COVID deaths. 445 new cases were announced today, most of them in Melbourne. This morning, authorities announced there'd been 2 deaths from COVID-19 in Victoria. But late this afternoon, it was confirmed another person had died from the disease. Nicole Asher joins us now for more. So, Nicole, what do we know about these cases?
So the first 2 cases we learnt about today, one was a woman aged in her 80s in the city of Brimbank, which is in Melbourne's west. She died in hospital. There was also another man. He was aged in his 20s. He died at his home in Hume, which is in Melbourne's north. Now, what's got authorities slightly concerned about his death is that he wasn't a listed positive case. He was actually diagnosed with coronavirus posthumously. So they're looking into what exactly caused his death and why the authorities didn't know about the case in his household, Tam.
And Nicole, is there much information about the person whose death was announced this afternoon?
Look, we've heard a little bit. So it's a 46-year-old man. His name was Martin Blight. He's known as Marty to the people who knew and loved him. We're told that he worked at a Serco call centre in Mill Park. Now, that site was designated a Tier 1 exposure site, and he was a close contact when he was diagnosed with coronavirus. We understand that he did have a booking for a coronavirus vaccination, but he hadn't got in yet to get that, and his family are now urging others to book in and get vaccinated without delay. But as those vaccination rates are rising, as you said earlier, the Premier has flagged that as of Sunday there'll be a lockdown, a pathway out of lockdown. But with the rising toll, the mental health toll on Victorians at the moment, the government has also announced $22 million for mental health. Here's Margaret Paul with the details.
Claire Graff Mitchell had a severe depressive episode in June.
There was a lot of uncertainty as to whether my wedding was going to be able to go ahead. I just didn't know what my life was going to look like from one week to the next.
She got help and got married, but the ongoing uncertainty still causes her anxiety.
Well, I survived that. Maybe I can survive this time as well.
And there are many more Victorians like Claire needing help. That's why the government is spending $22 million expanding mental health services.
20 pop-up community mental health services, 8 in regional Victoria, 12 in metropolitan Melbourne. And we'll have them progressively up and running from the end of this month.
Experts say it can't come soon enough.
With young people in particular being turned away on a daily basis from emergency departments in life-threatening situations.
Meanwhile, the virus keeps spreading with 445 new cases. 75% of today's cases are in Melbourne's north. And a software glitch has been blamed for incorrectly inflating the number of Indigenous Victorians vaccinated. The rate has been revised down from 60% having had a first dose to 45%.
The numbers just didn't add up. There was a lot more people on the record as being vaccinated, more than there are Aboriginal people in Victoria.
As more Victorians get vaccinated, we're getting closer to a roadmap out of lockdown. The Premier says he'll announce on Sunday what restrictions will look like across the state through to November.
It's about giving people a clear sense of what we're working towards. Whether we can all achieve it as a community, that's in the hands of the Victorian people.
The Premier says what's allowed when depends on getting people vaccinated and how many Victorians are in hospital. Margaret Paul, ABC News, Melbourne.
So here's where our vaccination rates are sitting at the moment. 67% of eligible Victorians have now had 1 dose. And it's possible that figure could hit 70% on Friday, which is the trigger for a slight easing of restrictions. The state government's under growing pressure to detail how it plans to get Victorian kids back into the classroom. The opposition is urging it to create special school bubbles. Here's state political reporter Richard Willingham.
This Fitzroy North Community School, the site of a major outbreak, is under investigation by the Registration and Qualification Authority over a potential breach of its legal obligations after it welcomed kids back to class.
Imagine the case numbers. Imagine the hospitalisations if every single principal was as irresponsible as this one. 2,200 schools, 1 million students.
The opposition is demanding kids back in classrooms as soon as possible, using rapid COVID testing, staggered recess and entry times, and school bubbles so students don't mix.
Are there any questions?
Term 4 begins in less than 3 weeks' time. What is the government's plans to get kids back to school at the start of Term 4?
The government is still doing its homework and says, like the rest of its roadmap, it will be ready on the weekend.
What we will do is follow the advice of public health experts. We won't undermine them.
Throughout this pandemic, discourse on social media has deteriorated. Now a report from a parliamentary inquiry recommends big changes, including eliminating fake accounts through identification, making it illegal to spread false information in political messages, and setting up a code of conduct for MPs online.
There needs to be a mechanism whereby you do have to identify yourself so that if action needs to be taken to take those accounts down, there is a mechanism.
South Australia already polices false material, but there is no model on how it could work in Victoria. But the committee says social media is on notice.
There are a number of steps we can take here in Victoria if we need to, if the social media platforms don't act and take action to address some of the concerns that we've raised in the report.
They're trolls that take on journalists, on epidemiologists, on the average individuals. I mean, it is outrageous.
Perhaps a solution to a global and growing problem. Richard Willingham, ABC News, Melbourne.
Health authorities in New South Wales say it's still too early to say if the Delta outbreak has peaked there. The state recorded 1,127 new cases, 130 fewer than yesterday.
It's too early to know if we're flattening the curve, but we're seeing pleasingly so far that cases haven't been increasing as fast as they have been.
2 people from Western Sydney have died, and there are now more than 1,200 COVID patients in the state's hospitals. The ACT has extended its lockdown for another 4 weeks, with restrictions to continue until at least the 15th of October. It comes as the ACT recorded 22 new cases, with just 2 of those in quarantine for their entire infectious period. There are now 10 patients in Canberra hospitals, including 2 in intensive care. The ACT has been in lockdown since the 12th of August. The Chief Minister says it can't be lifted until the current outbreaks in the Territory and surrounding New South Wales are under control.
We've chosen a path that protects the health of the community whilst maximising the level of safe economic activity and social activity that we can conduct at this time.
The government says it will review the situation in a fortnight.